So thank you for joining me while we discuss tooth staining and how to remove tooth stains, because this is a real concern for people and I think a very misunderstood topic. There are two kinds of tooth stains. There is a stain in your teeth that would be called intrinsic. When your teeth erupt into the mouth, they will have this stain on them, in them. They're built with the staining within the tooth. And there are various reasons for that, usually a disruption in the way the enamel lays down, sometimes caused by something like an antibiotic. Sometimes it's caused by the water supply that the child is drinking when they're between the ages of 0 and 6 years old, which is when the permanent teeth are forming. So lots of things, even a fever at a young age, can change the way the enamel is laid down. And because enamel is all about reflection and refraction of light, you will get different kinds of tooth coloring, and it's just the way a lot of it is. So if you think your teeth were stained when they erupted, that's how they are. Now, on that topic, however, if you have a child who's 6, 7 years old and they are erupting new teeth, when they come through, they will be contrasted with the baby teeth that are next door to them. And baby teeth are white teeth because they're a different structure. Permanent teeth will always look darker next to those very brilliant white baby teeth. The other problem with permanent teeth is they come through almost like a sponge. They are very porous because they haven't yet absorbed the minerals that they're supposed to absorb in order to mature the enamel on the outside of them. It takes about a year normally for a new tooth, an adult tooth that will come through to replace a baby tooth. It takes about a year for that tooth to fully harden. And in that year, the tooth will not only be very porous and prone to decay, to infection, but also will be very fragile and not have as many minerals as it should have when it's fully mature. Now, that's why I often talk about my complete mouth care system being used when children start getting adult teeth. A gradual introduction to the use of some fluoride products will help that newly erupted permanent tooth to become fully mature, to absorb minerals from the mouth, from the saliva, from the liquids in the mouth into it. And that will give it a whiter color. So just because your child's new tooth is looking very yellow, you can do something about that. You can start introducing them to the use of the more adult toothpaste that I recommend, and to a mouthwash, and to the use of xylitol frequently at the end of meals, and take some pictures. You'll be surprised. Usually, instead of it taking a year for that tooth to mature, with the use of those little strategies, a little different mouth care and the use of xylitol, you can condense the time frame into usually 3 to 4 months, which is super for that tooth because it gives it the strength and it stops it from being at so much risk for decay. So those are intrinsic tooth coloring, and the only thing you can really do is with a new adult tooth, you can certainly try to help it be a better color. The rest of the problems we all have with teeth and staining and coloring is not about the things you may think it's about. It's not so much about what you're eating and drinking as what you're doing and how you take care of your teeth. And we're going to talk about that, the best way to take care of your teeth to avoid them from staining, and to understand that just because you think that drinking coffee and drinking tea has stained your teeth yellow, it isn't the coffee and the tea that does the damage. It's the constant period of time when your teeth are in an acidic environment. When the acidity of the coffee or the tea is pulling minerals out of your teeth and making them porous. When a tooth is porous, whether it's a brand new adult tooth that's coming into the mouth porous, or if you're an elderly adult who is sipping on something acidic all day, or you're a teenager sipping on sparkling water or diet soda. Anything acidic for a prolonged period of time is going to soften your teeth, make it more porous, and make the tooth appear darker. And don't blame the oral care products you use. It's not the color of the Listerine or something in the act or the Closest or anything. There are a couple of oral care products that will stain teeth. But if you're following the regimen that I recommend, and you've followed it for a week or two or a short period of a few months, your staining is not anything to do with the products you're using. The staining you are seeing is the staining that most people get, which is a staining because they are not properly brushing their teeth with an adequately resilient toothbrush. And the kind of brush I recommend is called mouthwatchers, and they are resilient kind of bristles, and you need to not be fearful. Don't be scared of brushing your teeth. The stain you see is called extrinsic staining. And this extrinsic staining, it comes from things, from debris in your mouth becoming stained. And the unfortunate thing is that when your oral health rapidly improves, as it would if you started using the products I recommend, the plaque deposits that you have had on your teeth for decades, maybe, for years, certainly, for months, most definitely, are still stuck on your teeth. And they will become darker because they are dying off. And this dying off plaque can look gray or black on your teeth if you do not brush your teeth adequately. And in most cases, it's because people haven't invested that last piece of the puzzle, good toothbrushes. Or they are using an electric toothbrush that cannot brush this debris off the teeth properly. You need a good manual toothbrush, and you need to give it 24 hours between uses so that it's clean. You're not reinfecting your tooth surface with bacteria from your toothbrush. And you need to have it dry so that it's not soft and soggy. So don't soak it in things. Don't soak it in baking soda. Don't soak it in vinegar. Those things will disrupt what we're looking for. To protect your teeth from staining, we are not looking to super clean your teeth like we used to believe. That's the baking soda concept, the bleaching concept, the artificial whitening concept. It's so out of date because it so damages the health of your mouth. What you need is to develop healthy biofilm. That is a biofilm, that is a layer over your teeth made up of healthy bacteria, proteins from your saliva, and we allow it time to form over everything in your mouth to protect your teeth from staining. If you keep going for cleanings at the dentist and have all the biofilm stripped off your teeth, no wonder they stain, because you're losing this protection, the protection that not only stops minerals from leaching out of your teeth, that makes them more porous and more prone to staining, but you're losing this protective protein layer that is really your bulletproof layer that stops stains from occurring on your teeth. It prevents plaque from forming on your teeth. There's a difference between plaque and biofilm. And if you want to learn more, I have a book, Mouth Care Comes Clean, that really explains the difference. It explains how we used to think all mouths were infected with plaque. Today we realize a healthy mouth with healthy biofilm is sustainable. It doesn't need cleanings all the time, and it's there to help you and sustain healthy gums, healthy teeth, healthy mouth. I don't go for cleanings because I have healthy biofilm. It doesn't need to be cleaned off my teeth. I drink black coffee. I drink red wine. I don't worry about the foods I eat and drink, the blueberries, the blackberries, the strawberries. Don't worry about all these colored foods. They're so good for you. And if you have healthy biofilm, if you develop that, you'll be protected from these stains, even if you're drinking red wine, coffee, tea, within reason. Now, how do you develop healthy biofilm? As I said, biofilm grows when you allow it time. So after meals, you want to have a little bit of xylitol and then don't eat or drink for an hour or so. This will allow the healthy biofilm to form over your teeth and protect them. The other thing to do is to avoid sipping and snacking long periods of acidity. And the story I will tell you, there are two stories to tell you, because this dynamic of staining and cleaning, keeping your teeth, getting your teeth to be as white as they can possibly be, will occur at any age. Anybody at any age. You need to brush with vigor with a good toothbrush. You need to use the xylitol. I recommend my complete mouth care system. My mother had a friend who was 70 years old. And this gentleman was an engineer and definitely followed my routine exactly the way he was supposed to, like most engineers do. He did it perfectly. And for 10 years, he was unable to get back to his normal dental appointment. But after 10 years, he went back to Washington, where he had previously lived, and he went to see his dentist, having not been to the dentist for 10 years, but having been using my complete mouth care system exactly as described. His dentist looked in his mouth and remarked, "George, what have you been doing? What have you been whitening your teeth with? They look amazing." And the reason the dentist was intrigued was because right before George had moved to Florida, he had had a crown, a CEREC crown, done on a back tooth that was matched to his then yellowing teeth of a 70-year-old. Now in his 80s, having used my complete mouth care system, he had strengthened the enamel of all his teeth so much that there was a distinct contrast in color between his natural teeth and the crown his dentist had made 10 years previously. So just because you're 70 or 80 or even 90 years old, you can still improve the color of your teeth, just like the 7-year-old. It's the same principle. Using the strategies I recommend for mouth care and giving your teeth time to interact with saliva. Those are the two most important things if you want to avoid teeth darkening, whether you're old or young. And to keep the stains away, do some good gum massage, but don't forget, because that's what people do. They get so excited about the gum massage for gum health, they forget to brush their teeth. If you notice any staining, that's where you need to go. Go first. Go when you have the most toothpaste on your toothbrush. And make sure you're using the brushes I recommend. If you have an electric toothbrush that's full of mold or an old toothbrush, you're going to be self-defeating. So give it a fair shake and enjoy the beauty of shiny, healthy, natural teeth. And you can do it. And you can do this at any age. Don't be scared. And I would highly recommend avoiding artificial tooth whitening, because that, beyond anything else, sets you up for staining your teeth more quickly and more easily than anything else I know. And again, my final story was at a dental meeting where a hygienist who had uber white teeth. She had obviously used whitening products either in the office or by herself, I don't know. But she had so whitened her teeth for this dental meeting to impress us. She had forgotten, perhaps, and had a glass of red wine. I met her in the ladies' room where she was devastated by her purple teeth. And at that point, her porous teeth had absorbed the color of the red wine. There really isn't a lot you can do at that point except go home and start mineralizing your teeth and working to develop mouth health rather than artificially whitened teeth. So to find the right brushes, to know about the products, to learn the exact details that I talk about, I think the easiest place to go is the website, drellie.com, where we put links. We have all kinds of material. I have books, and there's an oral health video boot camp where you can learn more about the science behind all of this too. So you'll find a lot of support at drellie.com, drellie.com.